Hello, everyone, and welcome to tonight's webinar, Explain Pain. We will get going here shortly. Oh, it's great to see everybody showing up in the chat. There we go. Yeah, it's a gorgeous night here, isn't it? My goodness. Hello, everyone, and welcome. Great. Okay. Just let Mark in here.
Hi there.
Hello.
Oh,
Good
there we go.
evening.
That's somebody.
There you
Hi.
go.
How's everybody doing?
How is everyone? I'm good. I'm looking out at a beautiful sky here.
Mm,
Beautiful sunny blue sky. And yeah, people are checking in from all over.
yeah.
So really glad that you've chosen to join us here for this hour tonight. At least in Kelowna, it's a beautiful night. And yeah, we've put together a little bit of a different class. Well, different. It's we're trying to do pain education in different ways um, to basically allow the information that we're presenting about chronic pain that persists, just to download in different ways. And so we will do our best with that tonight. And yeah, so hopefully you can see us. If you can't, if you can only see the slide, you can change it to change your view to gallery view. And then you can see our little squares at the
Mm,
same time. So
mm.
feel free to do that. And yeah, Mark, I'll just pass it to you to get us going here.
Sure. Yeah. Welcome to everybody on behalf of the Bill Nelems Pain and Research Center. And yeah, a warm welcome to Madeline. Thank you very much for organizing tonight's webinar. Once again, it's great to see some familiar faces, some new faces or names. And yeah, this, as Madeline had said, this webinar tonight hopefully provides patients with some deeper understanding and a foundation to try and explain their chronic pain, you know. So yeah, we hope it's helpful. I would look at this as sort of a good place to start, just with some basic understanding of chronic pain. So yeah, let's turn it over to Madeline. We can launch the program, and welcome on behalf of the clinic. And thanks so much for joining us.
Yeah, great. Okay. So tonight's going to be a different take on the chronic pain primer, central sensitization class that we've done. And that class is uh, essential if your pain has persisted past 3 to 6 months, we say. It's really important. I cannot imagine not having this information and having ongoing pain. And it
Mhm.
really explains why this journey can be so frustrating for so many people until we start to understand and get tools that don't always have to rely, although it's good to have, if it works for you, to have the medications and even sometimes surgery along with it. But it's still, when we're talking about ongoing pain, to start to take back some of your own power through knowledge and skills, to start dialing back, to start really coming in to understanding your own pain condition, how it shows up for you, and what works for you in your body, in your nervous system, because you're the only one in there, I think, that can know what's working and what's not working. And this is a very different approach. And what we're learning now, and I'm not so much in the research fields, but I certainly have contact with a lot of people that are, is, lo and behold, we're finally listening to people who are in pain and listening to them as part of the research, part of the plan, part of the of developing pain management programs. So this information here tonight is based on a course called Explain Pain, which is based on a book, sort of like the Bible of pain, called Explain Pain by Lorimer Moseley and David Butler. That was published in 2003, I think. It was probably about 20 years ago. And it really started to look at the mechanisms of pain. So like pain, it's a complex book, and we've tried to distill it down to some essential things for that might be helpful for you. And these are Butler and Moseley were really the forefront of pain management, and I had the opportunity to interview Lorimer Moseley, and that webinar is up on the website. So just to give credit, that's where this information is coming from tonight. All right. So what we hope to do, because I do not take your time for granted, I want to make it worthwhile, is talk about briefly reviewing acute pain versus chronic pain, that they show up differently. They're two different things. And this is where a lot of people get stuck. And it's really sometimes a really difficult, sometimes there's a little bit of both. And I'll turn that part over to Mark. But it's also a very important distinction when it comes to management and treatment. Going to touch on central sensitization, and talk about how the central nervous system that we're living in, whose primary goal is for you to survive and to be safe. It's not, its primary goal is not your enjoyment, not your happiness, it's your survival. So that's an important point. There are many alerts coming in right now to your body, keeping you awake, vigilant in many different ways to any sort of threat. And threat, when it comes down to it, means danger versus safety. And we're going to give you at the end a new definition, perhaps, for managing your own pain that takes all this into consideration in hopefully a simple way. So Mark, I'm going to turn it to you to just give a quick overview of what is important for us to know about acute, a sprained ankle, versus
Sure.
ongoing pain.
Yeah, I think at the very outset here, it's really important to think about these two entities quite differently. Acute pain is something that happens, as you said, when you sprain your ankle. It usually doesn't last more than about 3 months, sometimes 6 months at the utmost. And it's really there as a protective mechanism. Initially, like when you sprain your ankle, it's really sore. And then, as the ankle heals, you might experience some pain in 3 to 6 months, telling you not to, walk in a certain way, or just, to guard the ankle while it heals. But pain that goes on beyond, certainly beyond 6 months, is not really serving you such a protective mechanism. And our understanding is that things have changed in the nervous system. And over a period of time, what's happened is that the nervous system has become more sensitized. And this is now chronic pain, which is somewhat of a maladaptive, if you want to use that term, maladaptive mechanism, because your body still thinks that it needs to protect itself, but often it doesn't have to, or not to the same degree as in acute pain. And this is what most of our patients that have had pain for 5, 10, or longer years have is this chronic pain where the nervous system has become ramped up and oversensitized.
Mhm.
So I
Yeah,
hope.
and amplifies that. There's this saying that neurons that fire together wire together. So when you're firing in this direction, they tend to wire together and get stronger and
Mm,
amplify that pain response. And if you don't know this information, like I always think back to so many people that I've met and different times I've had ongoing pain when I didn't know this. So I and probably a lot of you here would always think that there's something really dangerously wrong going on here. And then when it doesn't go away, it can really send you into places of distress, and ultimately, depression and anxiety. So that's a really important piece. And I just want to check in here in the chat for a moment,
mhm.
to just see if there are any questions coming up around that. A lot of you kind of heard this before, um, but I think the main part, the message here is that each person has an individual experience, whether it's acute or chronic. Maybe it's been there for 10 years, 20 years. It's still, all pain is real. And because it's due to the central nervous system, doesn't mean that it's any less painful, because it's still the same neurons firing the same message.
Yeah. There was a question about, acute chronic pain. No, I think um, we what really happens with chronic pain is that there are maladaptive changes in the nervous system, that the nervous system is almost on sort of a hyper alert where pain signals are magnified, as Madeline alluded to, with neurons that fire together, wire together. What that really means is that the acute injury is over, but even normal or light sensations or light degrees of pain or modest degrees of pain are interpreted as very painful and amplified in the nervous system. And this is why patients experience this ongoing chronic pain, where there is no actual acute injury. So put simply, I enhance sensitivity of the danger transmission in the central nervous system. That's really what's going on here. Central sensitization, it's not a disease or diagnosis, as we say. It's a mechanism by which we explain what's happened in the nervous system. It's a mechanism that we use to explain why the nervous system is so ramped up. So in the beginning, you have this sort of acute inflammation. Think of the sprained ankle, right? But we know, when we look at, the science behind inflammation, it has a few phases. You have acute inflammatory response, and then you have the healing and the remodeling over the next 3 months, maybe 6 months. The inflammation is gone, but some people will experience ongoing pain. Not everybody. And those that do, we have to look at a different mechanism. It's not like you keep re-injuring or re-inflaming the ankle or the back or whatever it is. I mean, yes, there are cases where that does happen, but by far and away, the majority is something's happened in the nervous system.
Right. So you get more of this ongoing pain up here
Mm,
rather than healing, and then a gradual subsiding as time
mm,
goes on. So just to kind of broaden our view for a moment, just to remember that pain is only one signal that informs the nervous system of threat. It's absolutely one that we need, and it's one that has kept us alive so far. But there's also a lot of other ways that are probably not as distressing to us. But sometimes it's fatigue. Sometimes I know when I've been counseling someone, that sometimes when we're getting to a topic that is, a little tender, a little raw, a little painful, that they will start all of a sudden feeling really exhausted. And I only noticed this after, a few years. And of course, it's more of the freeze or that collapse response where the body starts to shut down. And another one is muscle ache. So yawning is sometimes well, and when I say threat, I'm not saying that there is a threat. Sometimes it's internal, and but that something that's alerting the body that something needs to change. There's a need. There's a need that is wanting to be met. Itchiness, that's alerting us to something that, whether it's something you're allergic to or something that didn't agree with your skin. We need that itchiness to pay attention to. Sometimes it's a hot cold sensation. It can be sounds, sights, smells that are input coming in, anxiety, and that shows up in our thoughts. It shows up in muscle tension, shortness of breath. Those are all indications that the system is alerting, like something's up. And if you've ever had ruminating negative thoughts, your body absolutely thinks that you're in danger, because it doesn't feel good, does it? It feels tense, it feels anxious, it's worried, and worry is a kind of a subcategory of fear. And fear means there's something wrong. So just to broaden that, and pain is along with these things. So what happens when pain is persistent? So when it continues, we tend to be in a state of constant protection, right? That bracing that we feel in our bodies and sometimes our mind when it starts to have those, worried thoughts. That is a form of trying to protect you, trying to get you to plan for something. Let's figure this out. Fight, flight, or freeze is the state. And we have an increase in cortisol. It kind of wears down our systems. And danger effects, and of course, this is ongoing, everyday danger signals, not just one, you know, I don't know, grizzly bear coming, you know, come, coming into my room, because then that's when I use my fight, flight, freeze, and then it's over one way or another. This is ongoing pain. It affects many systems, and not only pain, affects all our internal systems. And one thing that is a really good place to start, even as we're talking about this, and we're going to get to some solutions, is when you feel yourself there, to start to just slow things down, to start to slow it down a little bit. And even, right now as you're listening, you can, just start to slow it down in yourself as you're noticing, taking in this information. And just start perhaps breathing a little bit slower, a little bit deeper. And we'll just slow it down. Maybe feel your feet. Know that you're safe right now because you're here right now. So that's always a good place to start. And when we do that, we start to lower the cortisol levels already in our system because cortisol gets us really revved up. And we need that. I need a little cortisol to get on to do a Zoom class. I need to, energize. But when we've had that over time, we start to develop digestive issues, high blood pressure, a weakened immune system, and of course, anxiety, depression, headaches. So just starting to slow it down starts to decrease the cortisol levels caused by being in fight, flight, freeze. No fault of yours, right? It's no fault of your own. Your body's doing exactly what it was designed to do. So here's kind of the model that we're using tonight. So if pain is this danger signal, one of many danger signals that has become amplified, overactive, how can we start to reduce the danger inputs and increase safety. And if you've been in any of our classes for any length of time,
Yeah.
you'll know that this is exactly what we're doing. It's just a different way to articulate it. So I really like this model of your own protectometer, protectometer. And so as evidence of danger moves up the indicator, pain goes up. And as the evidence of safety goes down, sorry, evidence of safety moves your protectometer, your thermometer down. And we start to think about it a little bit differently, not so much like I got to get rid of my pain. Of course, that's what everybody here wants. But more is how can I introduce more safety into my body and less danger? And I know when I introduce this to people, sometimes it feels more attainable, more manageable along this continuum, just like a thermometer. So, Mark, do you want to take this? I feel like I'm talking
Sure.
a lot.
No. We're talking about danger and safety, another definition of pain as we propose, because really, when patients perceive that they're in pain, um, they also perceive, danger, anxiety, stress, right? So, and pain exists um, when there's a credible evidence of danger in your body. That's usually more than a credible evidence of safety. So a lot goes around how we are feeling at the time, our emotional state. If we perceive that, um, we're in danger or threat or heightened anxiety, then that amplifies the pain, really. Um, when we can calm our nervous systems and through some of the mechanisms that we've been teaching, um, we can lower the threat level. We can lower what we perceive as pain. In the same way that when you're tired, stressed, anxious, your pain levels go up. Nothing's really changed. I mean, there's no new inflammation. Nothing else has happened. It's just how we as humans perceive things. In the same way, if we can calm and soothe our nervous system, we can lower our experience of pain. Because the other thing is nobody's pain is identical. People, everybody has a very individual experience of how we perceive pain, and it has nothing to do with how tough you are or how resilient, but it's how our brain perceives all these stimuli as to how we perceive pain. It's not just an inflammatory response. I broke my arm, I have this much pain. There are lots of other stresses and influences that come in from, sleep to diet to so many factors account how we perceive pain.
Mhm,
So I think what we're talking
mhm.
about is looking at those factors and recognizing how they influence our individual perception of pain. And
Right.
it's and that's why what is so important about understanding that there are many factors that go into perceiving pain.
Mhm.
Does that make
Yeah.
sense to anybody?
Let's check the chat. And, along with that, as you're saying that, I'm just thinking, this makes sense. Good. Yeah, ask any questions. That it brings it right down to you as an individual.
Mm.
And this is both can be a very empowering thing because often there will be people that will tell you, I don't know if anybody else has had this experience. Oh, you should really do this. This helps pain. Eat more broccoli. You'll get rid of your pain. Has anybody ever been told like something where somebody is absolutely convinced this is for you? And maybe you go and try it and maybe it works, but maybe it doesn't. And this is because, your individual inputs of danger and safety and what's going to help you are also individual. And I think this is where, pain management has been missing the mark until maybe the last 10 years or so of providing a whole, kind of array of different options for people. And also these classes, when especially empowered relief, when we start sharing what we do for our own pain, sometimes I always learn something new because everybody has so many great ideas and so many things that they've done for themselves. Um, so I just wanted to add that in
Hmm.
there.
Hmm. I think it goes back to pain is an individual experience, and it's it's individually experienced. So it's like if someone says that they're upset by something, you can't tell them, well, you shouldn't be upset by that. That's their experience. That's
Hmm.
that's
Right.
that's that's very disrespectful. It's denying them their experience, right? And
Hmm.
and so and we've done that for years as physicians. I mean, well, what do you mean you're in pain? I can't see anything wrong with you. I'm sure many of our patients have heard that, and it's terrible, right? It does nothing. It except undermines their sense of self-worth, self-esteem,
Hmm.
and doesn't validate their experience. And we now know through the more modern definitions of pain that it's not just an inflammation. It's a global experience of perception. And once you accept that, then you must realize all the factors that come into this global experience. And without paying attention to those factors, you're not going to address the pain.
Right. Right. And what we didn't realize, I think for a long time that X-rays don't necessarily translate into any meaningful interpretation of pain. Pain is whatever it is,
Mhm.
or even MRIs, or the fact that you have a degenerative disc may contribute, but if there's
Yeah,
not a direct
yeah,
correlation. So if you have had tests and nothing's showing up, never think that you're going crazy because your experience is whatever it is.
mm. On the
So
on the on the same vein, just because you have something doesn't mean it always accounts for what's going
right.
on.
Hmm.
You know, I'll often say to people, how are you feeling? Or, well, I have degenerative disc disease. Yeah, I understand that I'm not being disrespectful, but I'm asking you how you're feeling. What's your experience?
It's
Because
two different things, isn't it?
exactly, because what we'll see later is that most of us over 40 are going to have some disc degeneration. Yes, there are people who have disc degeneration where the pain's coming from the disc. I'm not denying that. But if everything just hinges around an MRI or an X-ray, we're going to miss the point completely. In
Hmm.
chronic pain, we're not
Hmm.
talking an acute pain where you suddenly have a
Yeah.
disc herniation and you have pain going down your leg and you have sciatica. That's different. That's acute. We're talking chronic.
Yeah. 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 Acute pain, if you want to see it as an ankle fracture, you need to see you need to see
Yeah,
exactly where it is.
yeah, exactly.
Okay, so what I want to introduce you to are your DIMS and your SIMS. And what these stand for in Explain Pain is DIM is a signal of danger in me. It's just a way of remembering it. And the SIMS are the safety in me. SIM, safety in me. So working with danger and safety. And this is an internal signal. So it's not it we take information from the outside, but for some people, what might be a dim is actually is a sim for someone else, and we'll get to that. So this is why your own personal plan is so important. So pain exists when the credible evidence of danger to your body is greater than your credible evidence of safety. And pain does not exist where your credible evidence of safety to your body is greater than your evidence of danger. And it does require some retraining. There's no question of how the neurons talk to each other. But if we look a little bit more closely here, when we look at what credible evidence of danger might be, it might be going to your doctor and hearing that there's nothing wrong with you, so your pain is probably not real. Now, if there's anything that's going to make pain increase, it's going to be something like that statement. Sometimes it's going to the same place where you first perhaps had an injury, or maybe it was a motor vehicle accident, or you had something upsetting or even emotionally painful happen to you there. Now, I don't know if anybody here has ever noticed that, but when I have worked with people who have pain and also trauma, that they've noticed that when they even think to begin with about, say, the intersection where they had a car accident, they feel an increase in pain and distress. And when they drive or even drive close to that intersection, they have an increase in pain. Now, has anything physically changed in their body? No, but every alert, every you know neuron in their body is going to say, "Ugh, don't go near that place again." And it's warning. Your body is incredibly wise and protective. It's going to say, "Don't do that," because the last time we went there, look what happened. And so this is really real. Um, the belief that you might end up in a wheelchair. Now that thought can be incredibly stressful. And to notice that, and then to notice how it feels in your body, you might look at shifting your thoughts. Receiving a diagnosis sounds bad without really knowing what it means, like not having information, or even reading their interest rates are going up again. Like, all of these things can be inputs into your, well, they are. They're all inputs. They're either neutral, danger, or safety. And then evidence of safety might be coming to a class like this, making an appointment to see a health professional, being aware of a scientifically proven path to recovery, like this one. It's all based on evidence. Having a local anesthetic, it could be a medication that blocks these danger messages. Knowing that you're not the only person to be in this situation. Having that support, being here, that in itself is sometimes just as powerful as the information. Loving support. It's one of those. As a human being, it's a safety signal. So another way to look at it, here we go, the protectometer. There's a pain zone and a no pain zone, and at a certain level, your brain will make pain to protect you. Are you consciously making pain? No. Are you causing your pain? No. This is what's happening all the time in our body. And when we start to become aware of it, then we have more of a chance to start to shift it. So the level changes all the time. Just like, the way you sit, the way you breathe, what you're focusing on, maybe the temperature. There's a lot of inputs at any given moment. And a person's normal setting may be higher than others. So there's no one standardized protectometer. There is an on alert zone. For example, just thinking about whether you have a headache may be enough to push the indicator up a notch. Okay, so I hope that's making sense so far. And sometimes it helps to have these visuals. So let's talk a little bit about how you can start to be your own detective here. And I really recommend that that you do this. Mark, you want to talk a little bit
Yeah,
more about the DIMS and
sure.
SIMS?
So, the danger in me, the safety in me. So, a couple of things that you might want to think about is that, we look at some of the influences. So, things you hear, see, smell, taste, and touch might be triggers, particularly negative thoughts, sorry, negative things that you hear, things you do, if you overdo something and you get pain, then you're going to associate any kind of physical activity with pain, as opposed to taking a more modest approach and setting yourself like realistic things to be able to do that are achievable, which gives you positive feedback. People that You know, they have a good day, so they go crazy, and then they say they pay for it, as opposed to learning to pace yourself, right? Things you say. If we know that if your thoughts are, or your speech is overwhelmingly negative, I'm going to end up in a wheelchair. This is terrible. You start living that life, because you know this is what you're saying. You'll believe it. I'm not saying that you can just fantasize and everything is great, but just be aware of how you come across. You know, and that doesn't just affect pain; that affects many other aspects of our lives. You know, things you think and believe. If you are always in a negative headspace, and believe me, I do understand that it's not easy to get into a positive headspace when you're in chronic pain, but it is a bit of a spiral. And I'm not saying you can just pretend everything is great, but the more negative you are, the harder it's going to be. So if you can introduce some positive things, look at what you were able to achieve today, no matter how small or realistic, and believe in yourself, you know. Places you go, if there's certain negative connotations with, you know, certain places, then avoid them. Same thing with positive experiences, you know. Again, people in your life, some people can be very supportive and encouraging. Some people can just be a drain on you. And just being aware that your interactions with other people, or other people's interactions with you, influence your mood, where you are in life, your belief systems. So if you're going to surround yourself with negative people and negative experiences, it's going to brush off. You know, you can't escape that, right? So yeah, just a few thoughts on
Yeah.
that.
Absolutely. And one thing I just want to add in here is that sometimes I think, well, I just will never go near that person or near that intersection, or I just won't move in that way. And we start blocking and avoiding. And I mean, there are times to do that, but there's also a way to just start gathering more safety in your body so you develop the resilience and the capacity that maybe you can move,
Mm-hmm.
be with that person and not be stressed, or move through that intersection, because we can't just start chopping and changing our lives so we're avoiding everything, because then we start living a very small life. um,
Mm-hmm.
Yeah, so I hope that makes sense. I think we have to start with this, and then we gradually expand from here as we start to develop capacity to and strength, and like Mark said, to believe in yourself that you can manage
Mm-hmm.
um, those challenges.
I think if I
So,
was going to add,
mhm,
sorry, to add anything, it's just the reason we bring these points up is if you're not even aware of them, then you might not realize the impact they're having in your life. So
right,
we do this just to bring light onto the various things that we don't always think of that might be influencing us. You know,
right,
it's
right, because
shining a
they're
light in the
not
dark.
always obvious.
No.
You might not notice all, but well, maybe you would do that whenever that person calls, that you get really stressed, and then you end up in pain in
Hmm.
bed. And so maybe you're afraid of the phone ringing, or when the phone does ring, you brace a little bit. There might be something to look at there. Um, and so it's really helpful to have like these sticky notes and start to really notice. And when I trained in this explain pain, they actually made us actually make one of these, and on a big piece of paper, and put the sticky notes on, and and start to fill them out. So and it might seem like a lot of work, but it can be really helpful to start to notice the little details of the danger, things you do, things you think, things, people in your life. And what any and as I said, anything that can be a dim for one person might be a sim for another person, and we'll look at that in a minute. So when your body's protective systems are turned on, these systems push the protectometer up and contribute to pain problems. So more advanced hunting might look like this. Asking yourself, what things in life are worrying me at the moment? Just, being radically real and honest with yourself. Really truly what things in life are worrying and just noticing that. How do you travel around from day to day? What does that look like? What are the places that you go or don't go? What else is going on at the same time? Sleep, maybe sweating, muscle spasms, odd feelings, not thinking straight, tired, short fuse. Maybe relationships are strained. So just starting to get, not to overwhelm yourself with, oh my gosh, there's all these things, because there are an equal amount of Sims in your life. And that's really important too. So finding Sims. So let's look at Sims that are hiding in hard to find places. So looking again, what are the things that make you feel safe or comfortable in life at the moment, even just a bit? It might be that comfy chair. It might be that particular painting that it might be that person. It might be just that friend when they call. It might be something that you wear. And when you start to look in hard to find places, you will likely find so many things. And you probably never thought you come to a pain clinic and hear about, looking wearing something really comfy, but it actually does give you a sense of soothing, a nurturing, and safety. Maybe it's, where do you go? Where do you seek out to vent, to chill, relax, have some time, recharge? Everybody needs these spots in their life where you can simply be, and be without having to do or say or be any different than you are. Can you think of a time recently when your pain was less severe? And what was different then about your environment, your thoughts, your activity? What was it perhaps that was creating less cortisol and more dopamine and serotonin in your body during that time? So this can be a very powerful experiential approach to finding Sims in your life. So you probably can't read this little pinwheel here, but the reason I put it up is, yeah, it's like
I'll stand on my head
um
right now. Just give me a second.
is to show you that any of these things can be a dim or a sim. So yeah, so if you look at any of these, you don't see your friends anymore. Now that can absolutely feel isolating and alone, but there might be some friends that's actually a sim because you don't want to see them anymore. So your partner says yes to joining you in a yoga class. That might be that's on the safety side. um, you come down with the flu. That's probably going to impact your body. The family pet dies. If you love that pet, that's probably going to be a dim because you're going to feel some pain. You're going to feel some loss. For some people, when their mother-in-law calls them, that might be a sim. For others, it'll be a dim. And so, really getting clear. Your doctor reassures you that you are not alone. There is hope. That is a big sim, and there's nobody here that there's no hope for. There's always, always, um, there's always hope. So, um,
Mm.
yeah, there might be something that stands out for you here. Your doctor is worried about your pain and suggests seeing a surgeon. Now, that could be for some people a sense of hope, and for other people, that might create a lot of fear. So I invite you to make your own version of what's happening in your life and what is creating danger? What's creating safety? You can come back to this as it's good to have examples if you want to in the recording.
Mhm.
So here we go. Here is the protectometer. To start, you can even take a piece of paper right now, and you can put a line down the middle. What creates safety? What creates what are your dims? What are your sims? And then the categories: things you do, think and believe, people, places, things you say, your senses, and things happening in your body. You If you have something on the dim side, try to put something on the sim side. For example, things happening in your body, we're going to be really good at detecting the pain, the uncomfort, the discomfort, the things that don't feel good. Equally, try to detect the sims. So I had a really good sleep last night. I really love it when I have that pillow and I feel comfortable. Right now, I am enjoying some comfort. Um, so don't forget to bring in those times where in your body you feel ease. Maybe parts of your body are completely unaffected by pain, and you probably have some of those. So we start spreading our awareness out from the threat to also incorporate equal amounts, at least, of safety. Okay, I think we're almost done with the slides here. So if people have questions, you can start putting them in the chat or in the Q&A. Mark, I thought it would be helpful for you just to go through some of these behaviors that
Right.
we try to help with at the pain clinic. But this is from Explain Pain.
Yeah. Um, so we know that there are a number of things that influence our our sort of nervous system, our immune system, our neuroendocrine system, safety mechanisms. So, like this evening, through knowledge and education, what we're hoping to do is shine a light on some of the things or the factors that might influence patients' perception and help them to understand, at least look at these things so that it's not just like, everything is ramped up. They can look at how these things influence their nervous systems, their neuroendocrine. Just by being aware of it, you can, you can change your behavior, or you can at least down-regulate it because you're aware of the influences. The perceptions of stresses, how bad you think the problem is. Um, if you don't realize what's going on, you could magnify the problem out of all control. And we've all done this when we've had an issue that's come up, you know. So you can basically ramp up your perception, or your pain, by just uncontrolled emotional response, like, oh, it's the end of the world, I'm not going to be able to do this. If you're aware of what's happening, you can down-regulate it. We know that exercise is generally healthy. And that doesn't mean that everybody has to go out and run a marathon. It's very individual, but setting healthy, achievable boundaries, getting out, even if it's for a walk, even if it's just sitting outside and doing some chair exercises, just being outside has a positive influence. Okay. Um, the healthier you think you are. So if patients think in the negative all the time, it's almost like the negative will beget the negative. In other words, that becomes your story. That's the song you sing, you'll believe it. And just being aware of that in the background. So you might want to pay attention to that. Um, what you tell yourself about how you are. If it's always in the negative, it's going to, the glass is going to be half empty all the time. Having good, healthy social supports, around you, family that understand, friends that understand, people that support you, having good medical systems in place, through support groups of people that understand you, speak the same language. Hopefully you found a safe place in the webinars, um, other things that can influence your pain perception is, individual beliefs in religion, science. Those can have an influence as well. Humor, we've done a couple of webinars where I've usually been the butt end of the joke, but using humor to just to de-escalate the pain response. And nobody's making fun of your pain. It's just that realizing through humor, you release hormones and, in your body that actually can make you feel just a little better for a while. It's really helpful. I mean, what's the alternative is what I often say, like, because nothing's
Yeah, you
changed.
might
It's
watch a comedy as opposed to a drama. If
yeah,
you're having a high pain day, it's
a really good
probably,
example. Yeah.
you know, a really good comedy
Yeah.
eventually helps.
Yeah. And then other things that are a little bit more hard and fast, a healthy diet that's lower in inflammatory foods like processed foods, high sugar content. We know that those are actually pro-inflammatory. They're not that great for you. Lifestyle changes, smoking impedes wound healing. That's why some surgeons will tell you, if you're going to have back surgery or whatever, you need to quit smoking. Because you know what? They know for a fact that there's a greater chance of wound breakdown, of things not healing properly. Okay. Alcohol consumption. I'm not saying don't drink, but, in higher amounts can affect not only how you manage things cognitively, but also, from an inflammatory and healing perspective, right? Also, there's a lot of calories. So, if you're going to drink a six-pack of beer every day, you're going to gain weight. And what's that going to do to your knees or your spine? It's not going to be good. So, things to be aware of, sleep. Sleep is when the body heals. It needs that restorative time. Many of us don't get enough sleep. We cut ourselves short, and we've done a number of webinars on sleep and how important it is. You just have to look at 2 weeks or 3 weeks ago, we did one on sleep. It's really important. Makes me really sit up and take note. As a physician who's done way too much call, I can just think of how that's influenced my life. It hasn't been good. So
And it's never too late to catch up.
No, it's not.
Take a few good nights sleep, a month of good night's sleep, or semi good. You can start to catch up.
Yeah.
Yeah.
I mean, all we're doing here is
Yeah.
trying to shine some light on things that we don't always look at. We're so busy trying to treat a specific cause or manage a specific, take this anti-inflammatory. We forget about all these other factors that are really quite important.
Yeah, absolutely. Yeah, so just this is our last slide. Some of the things that you might want to think about, and start to make your own list. Start to really, look at your life like a detective. What's helping? What's not helping? And again, you might set, some, what would you really like? What do you really desire to do? What's meaningful to you? And you can start to set some goals because you, again, like this is kind of the foundation that you can build capacity and then move towards things that perhaps are stressful. Exercising a bit more, moving a bit more. But if you find that inflames you, get lots of safety going in your body so that you can increase that your resilience. So really, if you can think about armoring yourself with a lot of safety in every way possible that you can think of, layer upon layer upon layer. And not only will you shift your pain response, but you'll find yourself better able to move through those things that are challenging for you.
Mm-hmm.
Um,
Mm-hmm.
so yeah, let me just check yeah. Oh, good. Oh, good, Madeline. It sounds like you've got a good physio that actually talks about these things too. There's some really good physios out there now. Have to make changes. Yeah, exactly. This is it. We'll talk about sleep. Um, yeah, yeah, exactly. Like a detective. So go around with a, bit of a magnifying glass and start getting, increasing your protectometer side of safety. perhaps decreasing your danger. And so much of this is actually within our control. Um,
Mhm.
However, don't be a perfectionist about it. Everything is an experience, everything's an experiment. There's no pass or fail. You try something that helped, that didn't. That's what this is all about, as we move forward to decrease the volume of the pain response in ongoing pain.
Mhm.
So I hope this has been helpful. Yeah, it certainly is. I'm glad that you're here on this road. Yeah. And
Mhm.
stop the share there. Yeah, so hope this gives you another way of looking at your daily life and perhaps making those shifts and changes, because when it comes to nervous system change, it really is the small shifts and changes along the way that start to make that 1 degree course correction that lands you in a very different destination. So, thanks to everyone for being here. Hope you can
Mhm.
still enjoy the rest of your evening. It's still light out here, so yeah, it's the
Absolutely.
days are getting longer.
Yeah. And yeah, thank you, Madeline. It's been a really good webinar tonight. Thanks for all your work. And
Good.
yeah, thank you to everybody for joining us. I think I am going to go for a walk right now. There's some daylight. It's a beautiful
Mhm.
evening. So good night to everybody. And
Night
thanks
to
for
everyone.
joining
And we
us.
do have a breathwork journey coming up on this Friday, just one of these pop up ones that we haven't planned in advance. Uh, haven't put it on the website yet. Or have I? I can't remember now. I'll just check that. And our next Monday night webinar, we don't have anything planned until April 8th. When don't miss it, it's going to be Dr. Sarah Robbins, who is a gastroenterologist, talking about gut health, the microbiome, and chronic pain. I'm
That,
so excited about that
that
one.
sounds
So,
really good.
yeah, yeah, it's going to be good. So,
Wow.
hope to see you there. All right,
Thank you.
everyone, take care. Good
Good
night.
night, everybody.
Good night. Bye
Good
bye.
night.